Welcome, everyone, to Creating a Family, talk about infertility. Today, we're going to be talking about things to think about before you begin treatment. But before we get started, I just want to acknowledge that I know people are worried and scared about the coronavirus and the impact it's going to have on their lives and their fertility treatment. I just want you to know that we have resources for you at creatingafamily.org. And we'd also recommend that you join our closed Facebook support group. We've been sharing both support and humor and all sorts of things over there. And we talk about our fears and what people are doing and what they're doing to help calm their fears and things. So I really do recommend that you check us out. And you can find that group at facebook.com/groups/creatingafamily, all one word. So, as I mentioned, we're going to be talking today about things to do before you begin treatment. And we'll be talking with Nancy Harrington. She is an infertility nurse for over 20 years with a specialty certification in reproductive endocrinology and infertility nursing from the National Certification Corporation. She is a senior specialist of clinical education at Alliance RX Walgreens Prime. And in this role, she creates and implements educational programs and training opportunities for patients and providers involved with infertility. She's also an active member of the American Society of Reproductive Medicine, where she received the Milestone Service Award in 2017. Congratulations, Nancy. She is also
Thank you.
the past president of the New England Fertility Society. Nancy, you are well equipped to help us think through things to consider before you begin treatment. And a large portion of our audience is in that exact boat. So thank you for joining us today to start at the beginning and give people some of the basic information they need when they're first beginning this journey, let's call it. Although sometimes it feels more like a roller coaster, but we'll use the metaphor of journey for today. Let's start at the very beginning. One of the first questions we will often get is how long you should try before you try to get pregnant on your own, before you go to a doctor. Now, we've all heard the general advice, wait, if you're under 35, wait 12 months of trying with timed intercourse. We're going to talk about that in a minute. And if you're over 35, 6 months. But let's parse that down a little more and get into the details. So, what would you tell people? So, how long should you try on your own before seeking a doctor?
Sure. Well, thank you, Dawn. Thanks for having me today. I'm looking forward to talking with you today. As you mentioned, there is a standard definition. If you're under 35, try for 12 months with exposure to sperm. If you're over 35, 6 months. But there's other things that also play in the role of when should I go to a doctor? I mean, we know our bodies. We know if we have a history of certain things that could affect fertility. So if someone has a certain medical history that could impair any kind of things to do with infertility, one of the first things that women really need to think about is, am I getting my period every month? You talk with women and sometimes they're like, well, yeah, I think my periods are regular. I get them every 2 to 3 months. Well, that's not normal. So even if you're under 35 years old, if you're not getting your period every month, there's a problem. It's not normal to not menstruate every month. That right there is a telltale flag that would say, I need to speak with my physician about this. And again, as you mentioned, over 35, it's, let's get there quickly. What's happened too is managed care has kind of put a definition around when can I go to the doctor?
Exactly.
A lot of insurance companies won't let a patient even go in for a fertility evaluation till they're past a certain amount of months of trying. So I guess it's just kind of, investigate for yourself what your benefit model may be if you are covered by insurance. And then again, look at your physical and your medical state, and how your menstruations have been over a period of a couple of years. If there's any potential issues with the male, certainly you may not know that right away. But if there's any kind of pertinent medical history, that should somewhat push somebody along a little quicker to get in and have some kind of an evaluation.
And if you're seeing, if you have a regular gynecologist, mentioning to her or him at your regular checkup, assuming you're getting them, that you are thinking about trying to conceive, even if it's a year off, that you're and getting some general, just sharing information with your general medical provider at the beginning is also, before you start, is also a good idea. All right.
Sure, absolutely.
So now we you called it exposure to sperm, but we also will call it timed intercourse or whatever euphemism for having sex.
Sure.
But so let's talk a bit about, because but when the general recommendation of trying X number of months, depending on, and I was really glad you mentioned, depending on your medical history, your menstruation history, and things such as that. We're assuming that that you're having sex during the fertile times when you could get pregnant. So let's talk, and we call it timed intercourse. So let's talk a bit
Mhm.
about the best time to have sex if you want to get pregnant.
Sure. That again is kind of varied per person. Again, a normal menstrual cycle per se, according to the textbooks, is somewhere between every 21 to 35 days in length. And so anything that falls outside of those parameters really needs to be investigated. So again, sit down with a piece of paper, kind of look at your past, several months of menstruations, and kind of try to mathematically talk about when is my fertile window. Well, in science, we define fertile window. It's usually 14 days prior to when you have your onset of menses or menstruation. So say an average cycle is 28 days, which we all, kind of learned about when we learned about menstruation cycles. That would put you at day 14. But say your regular cycles are every 32 days or every 34 days. If you count back 14 days, that's almost always the time that someone would be ovulating. And so, the fertile window is somewhat considered about 6 days, 4 to 6 days before ovulation occurs. So without using any kind of mechanical things such as an ovulation predictor kit or temperature charting or that type of thing, you can mathematically kind of take a look at it. Now, again, if you do have irregular periods, you really would be much better off talking with your primary care physician, talking with a gynecologist or a nurse practitioner, just to kind of get a better feel for, when that potential fertile window could be. And then, women often ask, well, should I have intercourse every day? Should I have intercourse every other day? According to ASRM, they will tell you can have intercourse every 1 to 2 days. So it still doesn't answer, a specific question to say, oh, have sex every other day or have sex every day. What it's basically saying is that if you can kind of plan around that window of time, that you would probably, both the sperm and the egg are at the, point where they would be most optimal for conception.
And when you say day 14, what day do you start counting in your menstrual cycle?
The first day that you have kind of a complete flow. In the fertility centers, when I was a nurse clinician there, patients would say, oh, wait a minute, I started my period, kind of last night at 11 o'clock. Well, we wouldn't really consider that day one, so once you've had almost, a full flow of a period, that's basically considered day one.
Okay, gotcha. Now, you've mentioned nowadays people immediately think in terms that they've got to have and start buying ovulation predictor kits. But as you point out, you can get a general feel just by assuming you
Hmm.
have a regular period, just by counting
Hmm.
days. So that's one thing to consider. But there are also some, in addition to ovulation predictor kits, which you can buy over the counter. But there are also some relatively low-tech methods that have been used for years and years and years before we had over-the-counter tests that are also amazingly effective. So let's talk, and these are for helping you determine when you are ovulating. So let's talk some about some of those low-tech methods.
Right. I mean, certainly, there are basal temperature graphs out there on almost all internet sites to do with women's health, with really good instructions on monitoring your temperature when you wake up, and explaining to you when there is an increase in temperature, what that is in relevance to your ovulation. Certainly, looking at cervical mucus or discharge that women most often find, during ovulation changes. They basically can kind of tell. Also, women sometimes will have some kind of a little bit of cramping on one side of the other when they're ovulating. They may think, oh, that kind of feels like something like cramps when one gets a period. So there are some medical things. And I think, as you pointed out, it's important to kind of start with the low tech, start with the know your body, know each month what's going on, because I think that way, you kind of have a more closer hold and a grasp on, what each cycle is going to probably introduce as far as conception methods.
So let's say that a person has been trying for a while, and they have decided that they need to see a doctor. What type? And so we get this question a lot. I mean, most of us, most women have not all, but most of us have a gynecologist that we have seen, or some of us even see regularly. So should that be your first stop? Or if you haven't gotten pregnant quickly, should you pop over and make an appointment with an infertility clinic first? And can you even go to your primary, let's say you have a primary provider, but no gynecologist. What type of doctor do you need to see when you're beginning to think, okay, I should be getting pregnant now. I'm not, I need to do something.
Sure. Certainly we would hope that most women, healthy women, are being followed regularly by a OBGYN or gynecologist for yearly pap smears, for those types of things, types of screening. It's never too early to start planning for a potential pregnancy. There's lots of things that can be done prior to conception that are helpful as far as the outcome of babies and mothers. And so, certainly the first point of maybe talking with someone would be an OBGYN appointment, but some women are also followed by, fairly highly level trained women's health primary care physicians. And so, it's just important to kind of decide where is my best care going to be offered. Preconception visit is kind of a standard term that we use now in women's health. In that, that visit is to talk about all kinds of things related to health prior to pregnancy. So, a preconception visit, the aim of that is to really reduce any kind of adverse health effects that may potentially contribute to both a pregnancy and a delivery. And so, providers should be talking to patients about, are your vaccinations up to date? What types of medications are you taking? Also, the CDC and ACOG, which is the American College of Gynecologists, recommends that all women that are trying to achieve a pregnancy, be taking some type of a supplement of folic acid.
Mm-hmm.
Folic acid has been shown to really have an impact on the reduction of any kind of neural tube defects,
Mm-hmm.
which, these are things that, we kind of take for granted, but there are so many different sites out there. CDC has some excellent information, American College of Gynecology, American Society for Reproductive Medicine. Even if you go in and Google preconception care, there's a wealth of information about it, and so it is important. You can definitely start with a gynecologist or like I said, a primary care physician that is focused on women's health, because again, they're going to talk about things that you could be doing, avoiding alcohol, avoiding tobacco products, recreational drug use, checking to make sure there's no real toxic environmental things going on. And so, talking about screening for viruses and things like that. So again, it's never too early to start thinking about it and to start talking to your practitioner.
Okay. So when do you know it's time to see an infertility specialist, a reproductive endocrinologist?
Well, I think a lot of that is based on treatment history. If you have gone through some technologies such as, artificial insemination or intrauterine insemination, at the level of the gynecologist, depending on age, depending on medical history, there are certainly broad age ranges of women that seek help from a reproductive endocrinologist, which, is a doctor that has a specialty training in reproductive endocrinology. These physicians go on and do a 3-year specialty, which training course, which basically, provides them with additional information above and beyond the OBGYN level to take care of women. And so, again, I think, there's some women that will go sooner than later. Again, getting back to some managed care, types of things, managed care sometimes, won't cover a visit with a reproductive endocrinologist until a certain amount of trying has taken place. But what I would really recommend patients to do is when you talk with your gynecologist, talk about who they work with kind of out in the clinical setting. Most OBGYNs in, bigger parts of the metropolitan United States have some type of a referral pattern. They're sending patients to infertility doctors a lot of the times in their geographical area, in their hospital area. They're familiar with them. And that, will give you the opportunity to maybe contact that practice, find out, about coverage, find out about costs. And that sometimes alleviates a lot of fear about going to an infertility doctor. I think a lot of the times patients feel like, well, if I go to an infertility doctor, I have infertility. And I think that that's, again, something that it's always, this opportunity is there to move on to a specialist. Just if you're with an OBGYN and you had a dermatology problem, you may see a dermatologist. Or if you had a ear, nose, and throat problem, you would go to see an ear, nose, and throat physician. I think we need to think of the reproductive endocrinologist as a conduit just like that. Someone that, it's time for me to get an opinion and to get a plan in place and not to really put it off, that type of thing.
I'm glad you said that, get an opinion. It's interesting, but I often find that people are willing to consider the idea of going to a specialist to get a second opinion. And I think you're right. I think there's a hesitancy to go because if I go, it means I'm infertile. We hear that from people. And even people who know that is perhaps not logical, it's still an emotional response, and that's real too. I mean, the emotional responses are important. And the other thing is that we hear from people is that if I go to an infertility clinic, I'm automatically going to be doing IVF. And neither of those are true. So I do think it's important to think in terms of if you're having trouble giving yourself permission or thinking about it, think in terms of just going for a second opinion and see what you hear. And maybe you don't need to be there. So it would be helpful to just to consider that as an option. Um, are there some tests though or treatments that can be done by your gynecologist, or all type of testing? Should you be at an infertility clinic to get the test?
No, I mean, there's certainly definitely tests that can be done by a gynecologist. They can certainly look at a woman's hormone profile. And so certainly, one of the major things that you need in order to conceive is a nice, healthy egg. And so, a lot of the times gynecologists will order hormone profiles to be done on female patients. And then that way they can look at estrogen levels and progesterone and those types of things and start there. If there's an obvious problem that certainly, requires advanced treatment, then they would, think about referring that patient out. Most OBGYN offices have access to having a semen analysis done, at a laboratory that is somewhat close in distance to the patient. And so those types of things also, a lot of the times, an x-ray of the pelvic area, which is a hysterosalpingogram or an HSG, may be done at the level of the gynecologist, just to kind of look at, is there a sperm, is there an egg, and is there a transportation system, which would be the pelvis, where these two can meet. And so those are kind of basic things that can be done just to do an initial assessment. Again, based on a patient's history, based on her age or his, that type of thing, it may be advantageous to do it at the level of a gynecologist, but also may be, advantageous for referral. And again, reproductive endocrinologists work closely with gynecologists. And so, when you do, if you do seek out the care of a reproductive endocrinologist or fertility specialist, they will look at your records and they will, determine what has been done and what needs to be done moving forward.
I'm glad you mentioned a semen analysis because that is something that can be a test that can be ordered through your gynecologist, and it's really one of the first tests that should be run. Uh, if for no other reason, it's less expensive and less invasive than most of the other type of testing. But and I'm saying this, I realize that not necessarily you, but we do caution people to not stay at your gynecologist too long and not have too many tests run through your gynecologist, because what we hear is that oftentimes reproductive endocrinologists are going to have to or want to run some of the tests again. They may have different ways of interpreting or different labs that they use, and and time is not on your side. So we don't want to see people spend too much once they realize they've got a fertility issue or a potential fertility issue, and they've had their semen analysis done, and so they have a feel for whether it's female issue or male issue or both. Then don't spend too much time at your gynecologist. At this point, what I say is, if let's say if you have a heart problem, at some point pretty soon you're
Right.
going to want to go to a cardiologist because that's a person with all the training for helping your heart get well, or for treating you so that you can live a full life with the heart problem. And so the same is true with infertility. The sooner you get to a specialist who has spent all those years training, the sooner you are going to be able to hopefully get pregnant. So anyway, we see people stay way too long at a gynecologist. So I'm just saying, consider sooner
Right.
rather than later.
Right, exactly. And I think too, you have to be a self advocate. A lot of the
Yes,
times, you may be told, oh, well, let's try, 3 more months, or let's
yes,
try 6 more months. And
yeah,
and I think, it's like you just said the thing about the cardiology comparison. Know your body, know what you want to get out of your visit with the physicians, and then make some decisions based on that.
hmm,
Again, sooner is better than later. And,
yes,
also a lot of the times, with ovulation problems, which is one of the most common forms of infertility for women, young women, and even older women, you from a health perspective need to be menstruating every month. So even putting off, not having normal periods, that's also a health issue. So, get into a situation where that's corrected, even from a health perspective, so that your hormone levels are adequate, that you're menstruating, that your bone health is good. All of those things, also are accompanying when some type of an ovulation problem is corrected. And
hmm,
so, it's kind of twofold. Yes, you're trying to get pregnant, but also, yes, you're trying to be healthy. You're trying to make sure that from a women's perspective, you're healthy. And like I said, every month you're doing what should be done from a female's perspective.
yeah. That's such a good point. So, what are some other reasons that I mentioned too, and that is the fear of fear of being diagnosed with infertility, and also fear that your only option is IVF. And I should probably throw out the other one, which is honestly cost. I mean, I think that's tied in oftentimes with the fear of IVF. But let's address some of the fears. What would you say to someone who is saying, "Oh, I just don't, I just do not want to get involved. I don't want to get on that roller coaster." I heard somebody say that to me last week when we were talking, actually in the Facebook support group, and she was like, "I just do not want to get on that infertility roller coaster." So, what would you say? I mean, to somebody who is just hesitant to make that first appointment?
Uh, as you mentioned, a lot of the times it's fear. It's fear of the diagnosis. And I guess it's try to conquer that fear a little bit by kind of thinking a little bit more positive about what the outcomes might be. When you see a fertility specialist, these physicians, these nurses, they open up a whole other avenue in your treatment protocol per se. So, once you go into an infertility specialist office, you're seeing physicians, you're seeing nurses, you're most often seeing a person that specializes in benefit and cost. you're seeing support personnel from either a licensed social worker or a psychologist. And so you're kind of walking into a whole new arena of care. And so, I think if you go into it with that, I'm going to go to a place that's going to meet all of my needs. And so, the doctor is going to work up to see why we aren't getting pregnant, but the nurses, are specialty trained in why I'm depressed or why I might be overwhelmed or why I might be fearful, and the social workers are trained to talk about, why you're feeling isolated from your family and friends. And so I think if you go into it more with more resources are available when you go into a reproductive endocrinologist or fertility specialist environment than per se, walking out of your gynecologist's office and them saying, there's nothing else we can do for you. I think sometimes the experience can be quite positive for some patients. I think they're surprised when they get to a fertility specialist office and realize there's a lot of other people there maybe in the same boat, and again, one of the key things, I'm from Massachusetts, and so we have a mandate that is pretty comprehensive, but one of the things too is patients are afraid of cost.
Yep.
Paying thousands and thousands of dollars. And I think one of the key people that are in fertility specialist offices, and I've been all over the country in my positions, is there's almost always someone that is a specialist and an expert related to what things are going to cost, what your insurance will coverage, what co-pays you will have. Physicians have implemented this in the last 10 years to be as important as a nursing position in an office. These are folks that are hired, and that's all they do is to try to be an advocate for the patient, to call the insurance company 10 times instead of 2 times to make sure, they're getting an answer. And, that to me is a huge resource for patients that I think are trying to get pregnant. And a lot of the times, you will have folks that don't know about that. They think they're kind of going from one doctor to another. And I do think, like I said, there's a fertility specialist office has varied folks that definitely are specialty trained, to take care of, like you said, that fear, that, feeling of being on the roller coaster. And again, patient advocacy, what do you want to discuss as far as your treatment plan, and have a plan, basically have a little bit of knowledge about, if I did do in IUIs or inseminations, like how many would you anticipate? And it's difficult because I know I'm a nurse and I kind of have these questions in my brain, but in other medical scenarios, I think we always have to kind of go in with lots of questions and, and lots of answers that we take back and kind of formulate a plan.
And I encourage people, if you are concerned about the financial aspect, share that with your clinic. That's important information for them to know. It might influence how they approach treatment, but there also may be options they can tell you about that can help lower the costs, things that you may want to consider. So all of those are things that, I agree with you that the financial people I often think are some of the most important people at an infertility clinic, because what we find is that they help reduce some of the anxiety, and anxiety is just not good for our general health and not good for our fertility either. So for all those reasons, we recommend getting to a clinic and sharing your fears and what your hangups are and your concerns, and you may be pleasantly surprised all the way around.
Right. And I think, too, you mentioned about the fertility benefits person. I mean, I know that there are some providers also that even if you're thinking about making an appointment with a fertility specialist, a lot of providers will offer you a phone call or to talk with someone in their office before you come, so that you're not sitting there understanding that, this was several hundreds of dollars that I wasn't aware of, And again, can't emphasize how important it is to speak to your managed care or insurance provider's benefits person even before you go, so that you get an idea of what would be covered, what wouldn't be covered, because another thing to understand is when you see a fertility specialist, maybe your first visit, it's pretty involved because, you're talking a lot about, health and medical things. But also, you don't move rapidly. I mean, they don't say, okay, tomorrow you're going to do this. Most fertility providers have a time frame, and even will tell their staff, we're not rushing into this treatment tomorrow because we have to make sure that we have adequately explored all payment options for this patient, whether it be, prior authorizations, whether it be she's eligible for some kind of a fertility assistance program. And so, again, I think to know that the folks on the specialty side in fertility practices know that, there are steps that have to be taken before all of a sudden, you find out that you're, undergoing some advanced technology without any kind of prior, investigation.
Yeah, and let's be honest, understanding insurance it's a specialty in and of itself, and one that I do not have, and it intimidates me, and so I
Hmm.
really, for any type of treatment that would cost any amount of money, I really need to have somebody holding my hand, and it's hard to
Hmm.
find outside. And yeah, you can call up your insurance company yourself, but it's also helpful to talk to somebody who's not at your insurance company, who works with lots of healthcare plans, who can help advise you.
Right.
And so, yeah, I couldn't
Right.
agree. Let me remind everyone that this show, as well as all the resources we provide at Creating a Family, and keep in mind that this show is only one of the many resources we provide, but we have an entire A to Z resource section for infertility. All of that, everything that we do, is provided to you for free because of our partners. And these are organizations that believe in our mission of providing unbiased, medically accurate information to the patient community. One such partner is Walgreens and Alliance RX Walgreens Prime. They provide specialized fertility pharmacy services through an experienced care team, which is available 24/7, and they are devoted to helping patients achieve successful outcomes. They understand the importance of timing and the need for personalized treatment, and they are committed to compassionate care and support throughout your journey to have a family. And we are so appreciative of their support. All right, so now we've kind of harped here a bit on the need to get to a clinic, but how do you find a clinic? Now you've mentioned one way already, in which is to talk with your gynecologist, because often your gynecologist can refer someone. And I will throw out another way, and that is to find out who your friends have used. And because the truth
Hmm.
is, you're going to be surprised when you start becoming more open, and you may choose not to. But if you become and start letting people know that you're struggling to get pregnant, you're going to be very surprised at the number of people in your friend set who have also experienced this. So finding out, getting referrals from your friends. But Nancy, let's talk about some other ways that people can find an infertility clinic.
Sure. I really like what you just mentioned about kind of speaking with friends and family, and again, not being surprised at how many folks have gone through some type of an evaluation or treatment. But when you get down to kind of some specifics about how to find a fertility program, the American Society for Reproductive Medicine, or as we refer to it, ASRM, they have a website called reproductivefacts.org.
Hmm.
This is a website that you can go in. It's patient oriented website. You can search by state, you can search by zip code, but it's going to give you a list of fertility providers that are in your state or in your region. Also, as Dawn mentioned, Creating a Family has an unbelievable, resourceful website, which offers an entire professional services directory for all kinds of fertility specialists. Resolve, which is the National Fertility
Hmm.
Association, also provides multiple resources
Hmm.
on seeking specialists. And again, it's just a matter of finding out where they are. And one thing that I've found as I've traveled to the United States is that sometimes patients think, well, that fertility specialist is 70 miles from me. I mean, in Massachusetts, we don't have that problem.
Yeah.
We have 11 or 12 or 13 programs, all within maybe a 10 or 12 mile radius. But there's certain parts of the country that it's important that you know that, even though the fertility specialist may be far away from where you live, it may involve you going, for your first kind of evaluation or appointment. But a lot of fertility specialists, they work with satellite operations. And
Mhm.
so, distance sometimes is something that they're helping patients with. And so, although your first visit may require a bit of a trip, type of a thing, usually monitoring and ultrasounds and those types of things can a lot of the times be set up with some type of a satellite system, some larger than others throughout the country. But again, these doctors and nurses understand that, it is a struggle in some geographical areas. But again, I think, talking with folks that have gone through treatment, I get so many phone calls from my kids, colleagues, and relationships asking, oh, your mother works in fertility. Does she know Dr. Such and such? Or,
Mhm.
does she recommend this one? And so again, it's just, perusing and looking and kind of just like you said, Dawn, which is, I think, is an excellent point, having the ability to talk maybe with a friend or a close colleague or something that has gone through it. And, we all know word of mouth is probably one of the best referrals you can get, as far as practitioners go, because a lot of the times, even if you go through a difficult procedure, if you were treated well and you were cared for well by a doctor or a nurse, you go away with a much more, positive feeling about that. So,
And more comfort going in. Yeah.
sure.
Another resource I'll throw out is the Society for Assisted Reproductive Technology. In some ways, the list is redundant to the American Society of Reproductive Medicine, but the Society for Assisted Reproductive Technology, we have acronyms for everything in this field, and that
Sure.
name is SART. They have
Hmm.
good information on their site for evaluating clinics, and they maintain the clinic success statistics, and they provide resources on helping to understand those statistics. And I should mention that at Creating a Family, we also have resources available on our A to Z resource page to help you understand both how to choose a clinic, what's important, and the second one is to understand the statistics. So we have resources there as well, including an e-guide on choosing an infertility clinic. So just throw that out there
Excellent.
as another option as well. One of the things that I know people get sick of it, but I do say it a fair amount. I always say to people, time is not on your side. And I say this to people even if they're in their early 30s, which we now think
Hmm.
of as, oh, I've got time. And I think, no, you really don't. Time is not on your side when it comes to fertility. And I'm sure you say that and hear that a lot. Why do why do we professionals say time is not on your side?
Well, I think, one of the things that I learned early on as a nurse was that fertility peaks in women in their mid 20s. And so, in my generation growing up, women considered having babies in their 20s. Now, if folks have babies in their 20s, you're like, well, why did she have a baby so soon?
Yeah, exactly.
Definitely, women's childbirth years have definitely almost skipped 10 years.
I know.
Women are thinking about having babies in their early 30s and up to 35. But egg quality diminishes, eggs age. And so the most important factor in conception, are sperm and eggs. Unfortunately, well, I said fortunately, sperm really doesn't seem to have much, detrimental things happen to it till maybe after age 50. But, with women, again, eggs are beginning to age. And so if women wait until, their mid 30s to try to achieve a pregnancy, they are considered already advanced maternal age,
Mhm.
at the age of 35. And so, again, it's really based on egg quality. It's based on the fact that, eggs when you're in your late 30s aren't going to be the same as when you're in your late 20s. And so, unfortunately, women are not ready a lot of the times to have babies
Yeah,
when their fertility peaks.
that's
And so,
unfortunate but true.
again,
Yeah.
it's true. And, And so I think, it's important early on, like we talked about earlier with preconception, looking at someone's hormone levels, looking at how well their ovaries are working. And that can be done with simple hormonal testing. You can take a look at the female hormones that are being produced every month. And by looking at the ratio of those hormone levels, you can somewhat get a good prediction on how the ovary is working. And so the other thing, too, that I've counseled patients is that, a lot of folks have a family plan that may involve more than one child. And so,
Yes.
when folks begin to try to achieve pregnancy later on in their 30s, a lot of the times, after maybe a first baby, they're met with what is called secondary infertility, where, they're not able to have another child based most of the time on their age and their egg quality. So again, it doesn't seem quite fair that, fertility peaks at 23, 25 years old. But unfortunately, that's biology, and there really, isn't anything we can do to really, stop that aging process.
It's such an interesting point, and you're absolutely right that we really have pushed uh, conception by a decade, and uh,
Hmm.
and it's absolutely true. 20 years ago, well, I don't know about 20, yeah, 20 years ago, I think. Well, certainly 30 years ago, but 20 years ago too, I think people were really. If you waited till you were 30 to start your family, you were considered older. And
Hmm.
now,
Hmm.
if you have a child before 30, you're considered starting a little early. So
Right.
it's just an
Right.
interesting
Yeah.
time shift, and for a lot of good reasons it has happened. Because our economics of our society and opportunities, just so many things have changed. All right, so
Sure.
important. Yeah, it's very important for us to remember that when we're talking, and also for people not to feel uh, bad about their decisions, because there are often really good reasons why people have made the decisions that they have
Hmm.
made. Let me share with you another one of our partners who through their support we are able to provide you this show and this interview. And that is Cryos International Sperm and Egg Bank. They are dedicated to providing a wide selection of high quality, extensively screened frozen donor sperm and eggs. And they come from all races, ethnicities, and phenotypes for both home insemination as well as fertility treatment. Cryos International is the world's largest sperm bank and the first freestanding independent egg bank in the United States. And we thank them as well for their support. Today, we're talking about things to consider before you begin uh, to think about fertility treatment, an important topic that we often don't provide a lot of information on. So we are very thankful today to be talking with Nancy Harrington. She is an infertility nurse and has been practicing, has been an infertility nurse for many years. And she is also the senior specialist of clinical education at Alliance RX Walgreens Prime. So, Nancy, we have been talking about infertility, but I think that something a lot of people don't consider as infertility, but in fact is repetitive miscarriages or recurrent pregnancy loss. So it's a different people. These people can get pregnant, but they can't stay pregnant.
Hmm.
So where
Hmm.
should but the truth is often so they're seeing an obstetrician at this point usually, but where should they seek specialized help or where should they seek help along the board if their problem is repeated miscarriage rather than the inability to get pregnant in the first place?
Sure. Repeated miscarriage or recurrent pregnancy loss is defined as a woman who has two or more clinical pregnancy losses kind of before the 20th week of pregnancy. And it's definitely a concern for patients. And so, again, going back to the reproductive endocrinologist or the fertility specialist, part of their training is, related to recurrent pregnancy loss. A lot of recurrent pregnancy loss is unexplained. And so these physicians really are trained to look at different types of things related to miscarriage, such as, what are the hormone profiles of a woman? What are genetic issues that might be, part of this woman's makeup or genetic makeup or karyotype. Are there any anatomical issues requiring maybe some surgical intervention? What are her lifestyle choices? Is there heavy smoking? Is there alcohol use? Those things really are part of a reproductive endocrinologist evaluation and training when it comes to women. And so it is part of the patient population that you would see in a fertility specialist office. It's not necessarily anyone, sitting in the waiting room having the same problem. There's patients in the waiting room that may have cancer and are referred to a fertility specialist to cryopreserve, possible eggs or embryos. There's patients in there, again, that have had several miscarriages that are in there to consult about how that can be eliminated. And so, again, that's where folks should probably make a visit to rather than just staying put and seeing if it happens again, per se, because there are interventions that can definitely, show women. And, ASRM has some outlines and some guides about, the fact that you can have a baby 60 to 80% of the time, even after having 3 miscarriages. And so patients should just make sure that they're knowledgeable that, hey, I'm still going to continue this journey, but I want to be with someone that has a specialty in helping me with this problem.
Yeah. And I'm glad you gave the statistic because the odds are actually in your favor, again, depending on your
Hmm.
age. Yeah. Excellent. Okay.
Right.
And I know I went off on this at the very beginning, but I think it is so important. I want to come back just to make certain that we talk a bit about male infertility and the importance of a semen analysis. The old saying, my mother always said, takes two to tango. It takes two to get
Right.
pregnant. And so and what percentage of the cases of infertility are male related?
Well, the percentages that are male related can be almost the same as a female. 30 to 40% of infertile couples may have a male factor. And again, as women, sometimes we say, oh, it's just a simple test. Well, maybe a lot of the times it isn't a simple test for a gentleman
Yeah.
to, go through that. But again, it's the cornerstone of fertility evaluation for all male patients. And, I know back when I was in my clinic, I would have gentlemen that would present to me and say, oh, I had a semen analysis done 5 years ago and it was normal. I don't need to have it repeated. Well, no, sperm changes. And so, in our clinic, we would look at semen analysis every 6 months to a year, depending on the protocol and depending on what the patient was going through. So it's important to find out if there is normal sperm. They look at how many sperm there are, how are the sperm swimming, how are they shaped, are there any kind of infectious cells inside the sperm? So it's really, something that gives a wealth of information about the male. And if there is a problem with the sperm analysis, most often, especially in a fertility specialist office, they will refer the gentleman to a specialty urologist or someone with specialty training in male infertility. And so again, it's important to note that there is sperm, that it looks healthy, and that there's adequate numbers, if someone's going to continue to, as you said, do timed intercourse without any kind of an intervention. But there are so many interventions that we can do now with male factor related to, kind of IVF and advanced technologies. That's only a very small population of patients that need it. But again, it's important to have it done and to, make sure you get any kind of follow-up that needs to be done if there's any abnormalities.
So, will insurance cover infertility treatment?
It all depends, basically, and unfortunately, I've been doing this for a very long time. Things have started to really vamp up in the last year or two, but it all really kind of depends on where you live and where you work.
Yeah.
And so, there are, currently 17 states that have some kind of fertility, offerings or mandates. And what's really a good sign is that there's now 7 states that have prepared legislature related to, fertility preservation, related to any kind of disease or cancer. And so, Again, it's an uphill
Hmm.
battle, trying to find out if you have coverage. I would just tell you to just question, question, question,
Hmm.
get things in writing. I have a friend that had fertility treatment right here in the state of Massachusetts, under a Massachusetts provider, but was living in a nearby state and was somewhat told in that state, oh, you don't have fertility coverage because it wasn't a mandated state. So, research it and look. There are some employers right now, lots of employers,
Yes.
within the United States that are developing benefit protocols and benefit models for fertility coverage because they
Yes.
feel that is most definitely a big draw for employees. Patients that may need treatment, will pick an employer that has a solid fertility benefit.
Or will
Patients.
stay at
So,
an employer.
right,
It's a good
right.
it's really good for, employee retention, and I'm glad you mentioned, I mean, we certainly know that there are, I think you said 17 states
Hmm.
that require that employers of a certain size provide infertility benefits if they're going to do business in the state. However, what people don't realize is that you can advocate with your company to provide
Hmm.
infertility benefits. It is a great benefit package. As you mentioned, it's good for new hires, it's good for retention. It is a smart business practice if companies are trying to hire people in their 30s and 20s, 30s, and 40s. So it's smart. And let me send people to the resolve.org website. They have some great resources for helping you advocate with your company, even suggesting there's information about that it makes good economic sense. They help you provide the argument to your company for why they should provide these benefits. So let me send you there and say, please don't give up just because you don't live in a mandated state. Uh, that does not mean that you can't take and do it even now and that you're thinking about treatment. This is the perfect time to start advocating with your company before you need treatment. So yeah, so the perfect time. I interrupted you. Sorry about that, but I always feel so
Oh, no, no,
passionate
no,
about it.
no.
Yeah.
That's no, excellent. I've worked with Resolve and over the years on different projects, and one thing they do have, like you mentioned, is good resources. They have toolkits per se, in place that you can link to on the website that kind of help you as a self advocate going to your HR person or going to someone at your employment that you can talk with about this. And again, it's an uphill struggle. And I think a lot of us find this a lot of the times with insurance and managed care. Sometimes to find out what's covered, what isn't covered, it's exasperating sometimes. But again, just stick with it and just, ask questions and get answers. And again, like you said, it doesn't necessarily mean just because you're in a mandated state, you would be covered, but it doesn't necessarily mean that if you're not in a mandated state that you wouldn't be. So again, I had to educate myself about this in one of my positions that I worked at in the past and learned a lot about, it's not just where you are, it's where you work, and it's kind of complex. But again, there's lots of resources out there that can hopefully help a patient get through the maze of it.
And the benefit provider at your infertility clinic is a great source of information as well. So and you don't even have to, oftentimes you can just do that a phone call as opposed to going
Sure.
in and scheduling an appointment there. So yeah, something really important to talk about. All right, let's move to talking about medications. We know that IVF, well, not just IVF, but there are oral medications and things as well. So, what type of medications are used to treat infertility?
Sure. Medications, infertility medications per se, most of us don't realize it, but the majority of medications that are taken to treat infertility issues are pills and by mouth.
Hmm.
Only a small percentage of patients will advance to IVF and those types of things. And so, most of your PO medications or by mouth medications are, dispensed by a regular pharmacy. You go in, you get the medications, you're given instructions on when to take them around your menstrual cycle. But a lot of medications that are involved with fertility and advanced technologies are injections. And the reason they're injections is because most often they're hormones. And unfortunately, we still cannot take, the drugs associated with fertility, by mouth. We have to do subcutaneous, which means kind of the smaller allergy, kind of insulin type needle injections. Once in a great while, there would be another type of injection, but it's not very frequent. And so again, the majority of these medications are used to either, number one, correct an ovulation problem. So every month you're not making adequate hormones, so your brain somewhat shuts down and doesn't work properly to signal your ovaries. And so by giving these medications, whether it be by mouth or injection, you're just helping the body along to kind of somewhat supplement those hormones. That's kind of the first line of use for fertility medicines. The second line of use that fertility medicines evolved to was their use with, advanced technologies such as IVF, in that you want to make multiple eggs. And so, you're not only just correcting to make one egg, you're giving additional medications and hormones to make and harvest additional eggs so that the procedures have a little bit of a higher pregnancy rate. And so again, these types of injectable drugs are supplied most often through the country through specialty pharmacies. Specialty pharmacies take care of patients with all kinds of chronic and advanced diseases such as oncology, MS, rheumatoid arthritis, and fertility falls into that basket. And so at a specialty pharmacy, you will get a lot of resources along with these medications. There are folks that help you, learn how to store the medications, learn how to mix the medications, and learn how to inject the medications. And so, the model for specialty pharmacy is evolved tremendously over the last 15 years in that, patients do have a solid resource, such as Alliance RX, Walgreens Prime, which is a specialty pharmacy, to have that resource, because there's nothing more intimidating than getting a box of medications and thinking, okay, what do I
Now
do with
what?
this?
Exactly.
Now what?
Now what? And it's
and so
scary.
there's
Yeah, it's absolutely
right, very
scary.
scary.
And that's why
Yeah.
we encourage people to, well, first of all, you may have to, these medications are often not available at regular pharmacies, but the other reason is
Right.
you want to go to a pharmacy that's what they do. So when you have a question of, do I have to put this in the refrigerator? They can say, oh yeah, that's the one you put in, but this other one you don't. And they can just walk you through it, which is, it's a godsend. It really is.
Yeah. It's like I said, it's a nice resource for patients. It's one less thing for them to worry about. There is a very, close relationship and close communication between a fertility provider and a specialty pharmacy. And, they get to know each other very well. And so, they work very cohesively together. And so that ultimately the patient benefits, from that collaboration.
And
So.
something to else keep in mind is that timing is important. You need your medication when you need it, because this is all a time, at some point, it becomes a very closely timed medical treatment. And you need someone, a pharmacist, who understands the importance of, okay, I've got to have this now. This is not come in next week and we'll get it in. No, that is not how it works. Yeah, it needs to be
Right,
done.
exactly.
Yeah, exactly. So
Yeah.
okay, well, thank you so much, Nancy Harrington, for talking with us. If listeners want to get more information, where should about you, or about Alliance RX Walgreens Prime, or about infertility, or about things to consider at the beginning of the infertility treatment? I know you guys have a fair amount of resources too, because you're kind of in the business of helping people at this stage. So where should people go if they want more information?
They can go to Alliance RX. It's alliancerxwp.com. We have a wonderful patient care booklet called Understanding Infertility. It contains a lot of the information.
Yes.
It contains a lot of what we discussed today. It doesn't just talk about, medications. It talks about lifestyle and diet and nutrition and stress and those types of things. They can also go to walgreens.com/fertility. Walgreens works quite closely with Alliance RX Walgreens Prime in that they've established, I think, close to 11 fertility specialty pharmacies throughout the country so that there's adequate resources for patients, geographically and regionally. And they can also email me. I am nancy.harrington@alliancerxwp.com with any kind of questions, and I'd be happy to help folks and lead them to any resources that might be helpful on their journey. So thank you again for having me, and good luck to everyone that's out there that's on this journey.
Thank you so much for helping to demystify the beginning steps. I really do appreciate it. And to our audience, everyone, take care, stay healthy, wash your hands, and we'll catch you next week.